cancer management. I've seen cancer progress from the minor problem in some Western countries to a global epidemic in my 40 years of my healthcare work. I was fascinated with the low incidence of cancer in Asia during my medical school training in the 70s. I wondered what was the reason that cancer used to be an uncommon problem in China, and now it is a big problem. I had already started to study Chinese medicine, and thought that lifestyles, exercise and diet probably played a big factor. I figured that if we can find the chemical origin of cancer that we could prevent it and treat it better, and in the course of the last 3 to 4 decades of my studies I've already began to realize that cancer is a metabolic disease. From the beginning of my medical school training, when I read that people kill cancer cells throughout their lifetime with their immune system, I wondered what happens to those where the cancer spreads around the body. It then also became clear to me why people suffer so much from cancer and why the survival rate is so poor with most types of cancer. Also, I have looked into why cancer is not detected early on and spend a lifetime looking at biomarkers and the underlying cause of cancer, and part of this was to be able to better manage the disease. Have also was disturbed by cancer treatments that killed good cells instead of supported healthy cells that are part of our immune system to fight against cancer and kill cancer cells. Looking in it deeper, I began to realize that the cancer treatments affect tumor cell energy and create a rational environment that's conducive to the growth of cancer cells. I was also concerned about the information from surgery, the spread of cells around the body from biopsy and surgery, and of course the damage to healthy cells and information around areas that are being radiated. These are the 3 main treatments associated with cancer, and there's not been adequate amount of management for tumor cell energy metabolism and metabolic balance, correcting the issue microenvironment that's conducive for cancer. There's been a view of cancer as a genetic disease, but it's been based on idea that mutations caused cancer by themselves, but genetic abnormalities and instability are linked to problems inside our respiratory insufficiency, tissue hypoxia and acidosis. I and my colleagues are continuing to research the metabolic cause of cancer to come up with better tests for evaluating the underlying cause of cancer and ways to monitor the metabolic state and ways to assist in the management of cancer in a more rational manner. I've also realized that some of the anti-cancer drugs work by reducing caloric intake of the cancer cells. If the right reduction caloric intake could target majority of the cancer problems, it could be managed better. Also been very interested in the ketogenic diet because the brain and the rest of the body can operate quite well on ketones for its normal cellular function, and the ketogenic diet can adversely affect the growth of cancer cells. Another concern with current cancer treatment is that patients are not taking a proactive stance against cancer. They are offered toxic drugs that reduce their strength, reduce their immune system, and even reduce their desire to fight off cancer due to fatigue and overall lack of energy. The cancer treatment itself is ominous. Psychologically, patients are faced with the trauma of therapy consisting of burn, kill, and cut. Patients psychologically and physically have a tendency shutting down, knowing they're in for a tough battle, that it mars the ability to fight out cancer. Worldwide resources need to direct energy towards the evaluation and in management of cancers and metabolic problem we have throughout the world. Education and individualized testing are going to be very helpful tools for people and doctors to manage cancer better, get an early diagnosis, and treat the underlying problems associated with cancer. For more information on this topic, go to www.Cancer.im and follow our work, or to contribute your knowledge, research and experience on this website and explore our social network.